Hi, this is Dr. Chaman Wheeler here at CCC Help, where we specialize in primary care, pediatrics, wellness, functional medicine, and holistic health. Today, I'm here asking you to partner with us to restore the physician-patient relationship and rebuild the covenant of trust in America's healthcare. Hi, it's Dr. Chaman Wheeler. I have over 20 years of experience taking care of the ill in our society, from the emergency room to critical care to just the hospitalized setting. And during this process, what I realized is our healthcare system here in America is really based on illness, where every business needs a profit motivator, and our system, the profit motivator is illness. And so what I'm here to talk to you about is how can we transform America's healthcare today from the profit motivator being illness to the profit motivator being wellness. And I'm here to tell you that to do that, it is the fundamental important thing we have to do is restore the physician-patient covenant of trust. And if we can restore that to what is meant to be, we can change our America's healthcare to be wellness focused. So talking about this, how did we get here? How did we become a society where illness was profitable? Well, as you know, in the olden days, you went to the doctor when you were sick. So the seed of the profit motivator was always there because you only went when you were sick. You didn't go to the doctor to stay well, you went when you were sick. In some Asian cultures, like in China, the doctors actually got paid if you were able to keep the family well, and they actually didn't get paid when they got sick. So coming from my Eastern background and all of those things, I bring that into this conversation to where we need to change the business of medicine to be profitable, to be well. So that seed that was always there, the current system, our business leaders who are very efficient business leaders came into the system and took that profit motivator and made it is the most highly profitable possible. And that is with the ICD codes. Every diagnostic code we add on a patient, the more profit it generates. The more codes, the more billing, the more we can get. So that's what we can talk about a little bit here with the profit motivator ICD. But there's our current model not only does the ICD codes, there's three ways we can look at it. One is limited time. These codes also allows us to have limited access, and insurance that determines if the code is worthy of being covered or not. So really, it isn't the doctor or the patient in that relationship that decides your care and what's best for you as an individual, but it's these three things. The ICD codes dictates three things, again, limited time, lack of access, insurance mandates. What happens in limited time, because a doctor only has maybe 10-15 minutes for that appointment, you're not thoroughly able to be evaluated. That increases the amount of referrals to a specialist or to somebody else. So that generates more income for the system. Lack of access. You're sick, you can't get in to see your doctor. You have no access, maybe to be seen by the end of the week, 4 or 5 days from now. What does that do? You go and use an urgent care. So that creates more profit. And then what about the third one, insurance? You come in, the doctor thinks this one treatment for you is maybe what's best for you, but insurance says you need to go through step 1, 2, and 3 before you can get to that step 4. So that increases revenue for the system. Today in America's healthcare system, 92% of healthcare leadership is business owners, and they do a very good job of where illness is profitable. Only 8% of our system is physicians as leaders. So it is our fault as physicians. We abdicated the right to the business of medicine, and it has become a system that where the patient is not the center and the reason for the system, where the patient is really a commodity that's bought and sold. So we really need to change the system and get it back to where the doctor-patient relationship is the fundamental core that is the profit motivator for the system. So I'm here to speak on that, is to say that we need to replace the central core of the system from being ICD codes to the doctor-patient relationship. And that is the only way we can restore America's healthcare system to go from illness to wellness as being profitable. So how do we do this? Well, we can do this by the most purest way, in my opinion, to do this is direct primary care. Direct primary care, the word direct, it means there's a direct relationship between the doctor and the patient. So that is the profit motivator from the concept of it. Because in direct primary care, it answers those three things we talked about, where ICD codes makes the profit motivator illness. It goes away. So number one, the limited time. In direct primary care, there's no such thing as limited time. The doctor, you have unhindered access to the doctor 24/7, and you will spend as much time as needed to figure out what is going on with you. So there is a time and a place for referrals, but it's not because there's not a lack of time. The access, once you have a direct primary care doctor, you have 24/7 access. There's no reason for you to ever go to the urgent care. Now, should you go to the ER if there was an emergency? Absolutely. But your doctor is there to be your advocate and talk you through the process and see where you need to go, or if they can just be seen by you through a telemedicine visit, or even come in and open the office doors and see you in person. And since it's based on a membership model, the number 3 also goes away. Insurance is not an issue because we don't take insurance. Direct primary care is a membership. So really, if we think in that specific instance, step 4 is the best thing for you to do, then we don't have to go through step 1, 2, and 3 that insurance says. We can go straight to step 4 and to get you better quicker. So that is the most purest way to change healthcare, so that we can make the profit motivator going from illness to wellness and restore the doctor-patient relationship. For more information, please visit our website at ccchealth.info or call our office at 484-646-3900. Together, we can restore the physician-patient covenant of trust and rebuild healthcare.